Do you sometimes notice strange purple or red spots on your skin that don't go away? Or maybe you've seen swelling in your legs that feels unusual. These could be signs your body is trying to tell you something important. One rare condition that causes these kinds of changes is called Kaposi Sarcoma. It's not just a skin issue. It's a type of cancer that starts in the cells lining your lymphatic vessels, which are like tiny pipes helping your body fight infection and drain fluids. Think of it like a clogged drain in your bathroom. If the pipes are damaged, fluid builds up. Similarly, when these lining cells grow out of control, they form tumors. Let's explore what causes it and how doctors find and treat it. So what causes Kaposi sarcoma? Imagine a tiny virus moving into your body and setting up a long-term home. That's what human herpes virus 8 HHV8 does. Most people never even know they have it, but in some, especially if the immune system is weak, it can turn dangerous. For example, think of your immune system as a security team. If the team is strong like in healthy people, the virus stays quiet. But if the team is weakened, say, due to HIV, or after an organ transplant, HHV8 can take over and cause cancer. That's why Kaposi sarcoma is more common in people with HIV or those on strong medicines that lower immunity. It's like leaving the doors unlocked. Trouble can sneak in. Have you or someone you know seen dark purple, red, or brown spots on the feet, legs, or face, and they just don't fade? These aren't bruises from bumping into something. They're often painless at first, but can grow into raised, firm patches or lumps. Sometimes, the legs or face swell because the lymph system can't drain properly, kind of like a traffic jam of fluids. In more serious cases, people may have stomach pain, trouble breathing, or constant coughing, meaning the cancer might be inside the body, like in the lungs or gut. These signs often appear slowly, so they're easy to ignore, but if they stick around, it's important to talk to a doctor. How do doctors know it's Kaposi sarcoma? It's not just about looking at the spots. They usually take a small piece of the affected skin called a biopsy and check it under a microscope. It's like getting a sample of mold to see exactly what kind it is. If the person has HIV, finding these typical lesions might be enough to diagnose it, especially with the right symptoms. Once confirmed, treatment depends on how serious it is. If the immune system is weak, strengthening it, like using antiretroviral drugs for HIV, can often shrink the cancer. For specific tumors, doctors might use radiation, like a targeted beam to zap the lump, surgery to remove it, or chemo. Imagine it like a multi-level cleaning plan. Fix the root problem, immune system, then clean up the mess, tumors. Can you stop Kaposi sarcoma before it starts? You can't avoid the HHV8 virus completely. It's often passed through saliva, like deep kissing or sharing utensils in some communities. But the best protection is keeping your immune system strong. If someone has HIV, taking their medication every day is like giving the security team daily training. That way, even if the virus enters, the body can keep it under control. For people on immune-suppressing drugs, like after an organ transplant, doctors watch closely for early signs. It's like having cameras around your house. The sooner you spot something off, the faster you can act. Here's some hope. Scientists are learning more every year. Recent research is looking at drugs that target HHV8 directly, kind of like a wanted poster for the virus. Others are testing new therapies that help the immune system recognize and attack the cancer cells better, called immunotherapy. Some trials are even using drugs that stop cancers from growing new blood vessels, like cutting off supplies to a fortress. While there's no miracle cure yet, many patients now live longer, healthier lives, especially with early care. Think of it like upgrading the security system. Newer tools mean better protection.